Hi, I'm Kristin Health, and I'm here to talk to you about the later part of my breastfeeding journey. So, I found a video the other day that was from very early in my breastfeeding journey, probably around 6 to 8 months. It was still pretty early. I could see my baby was pretty young, but it wasn't like initially after the birth. It sounded like I had gone back to work and started pumping. So I did breastfeed my first child through a little bit after the second year. The World Health Organization does recommend breastfeeding through 2 years or beyond. I did get pregnant a little bit after two, right as I was starting to wean it down. I wasn't getting pregnant, and I actually did want to get pregnant again, so I did have to wean down to get pregnant again. And then once I got pregnant again, I just wasn't really feeling that good, and I'd pretty much almost weaned. And so I think I had some visitors and I skipped a day, and then before I knew it, it was just, I wasn't really producing much at that time. And so then I had my second pregnancy, or second full term pregnancy, because I did have two losses. And I had my second son, and I was able to get his tongue tie released in the hospital, which was awesome because I didn't go through that period of time like I did with my first son, where he was having trouble getting the milk out and he was cluster feeding. And it's kind of hard to remember, but I just remember that it wasn't really that bad. And so I've decided to wean him at 2 years. So I'm almost done with my breastfeeding journey, and I think overall it's been hard at moments, yes, for sure. I think I have a sneaking suspicion that I have Raynaud's syndrome, where I'm just very sensitive with breastfeeding. It's not always comfortable, but I have a high pain tolerance, so for the most part, it's been okay, and except for some hard moments. Definitely when I would first get my milk, I would be really, really engorged. That part was uncomfortable, and then sometimes just nipple trauma at the beginning. But overall, it's just such an amazing experience to have that bond with the child. And just like if they get a really bad cut or something and they're crying, then you can feed them, and then it calms them down. It helps them go to sleep. Like when you're on the plane and you're trying to calm them down, it's a good way to calm them down. I just thought it's been an amazing experience. I I wonder about the women that seem to have lots of issues as far as like feeding in public. I didn't really have a lot of issues. I would usually just go to another room and feed, so I wasn't necessarily really open about my feeding. Sometimes I would feed in the car, like, and maybe I'd be open, but I figured like nobody, I guess I just didn't want to get into it with people. And so I usually just did it in another room, but I would occasionally do it in the car or like on an airplane with a cover. So I know that's all controversial, but I just don't like the confrontation. So I often didn't even tell people that I was breastfeeding up until two, just because of judgment. And you can judge me for not telling people, but I just felt like it was easier to not mention it and just do it, and not brag about it. Or I just didn't want to get into arguments because people have so many opinions about different things. And I also want to say I fully support the people who can't breastfeed, who've had a difficult journey. I have a coworker who her son was in the NICU. She had preeclampsia. Her son was in the NICU. And it was just really, really hard for her to breastfeed. And that's fine. I know she was doing the best that she could in her situation. And I was really, really lucky that I could breastfeed my kids for 2 years. But, not everyone can, and that's fine. I was also listening to that video about the oversupply, and I don't think I had as much of an oversupply this time of pumping, but It's really hard to remember. I think also I'm really a big fan of slowly decreasing the breastfeeding over time. So I guess I would definitely have an oversupply in the beginning, and then you build up your supply, and then you start cutting back on your pumps, so that by the time I got to a year, then I didn't have to pump anymore. But although I felt like maybe I might have pumped a little bit longer, because I mean, honestly, when I would pump, I worked from home, so I would just be continually working while I was pumping. So I'd just be doing like emails or whatever, things that I could do while I was pumping. So I didn't really like have to use work time necessarily, since I would just pump through working. But yeah, I would generally start off with 3 pumps per day, one in the morning, one at lunch, one in the afternoon, and I'd either let it just run however long, or at least like 15 minutes. And then as the year started to, as I started to go through the year, then I'd maybe drop the lunchtime pump, and then I would drop the second pump and maybe just do 1 pump, and then eventually I would just drop all the pumps. But generally just like dropping it down to 3 breastfeedings a day, and then maybe drop down to 2, and then drop down to 1. So you're just gradually decreasing that supply. And then that way there's no like abrupt end to it. You just kind of gradually get to where you're not even really producing very much at all. So then when you stop, it's not really a big deal. You kind of just dry up, and there's no really discomfort or anything. So overall, I just think it was such a very special thing, and I really appreciate the blessing of being able to do that. Again, I don't, if you're not able to, then you're not able to. I mean, we do the best that we can as mothers, and I know, it's very controversial, like how long you breastfeed, whether you breastfeed or not. And I know we all try the best that we can, and some people, they just have very challenging experiences, and that's their experience. And I know we're all doing the best that we can, but I just want to encourage you that it can be an amazing experience. So again, I'm Kristin to Health, and I hope you have a great day.